Well, first off, I've seen that this is a very safe vaccine. Not only is it very safe, it's very effective vaccine, is what we're seeing. We have vaccinated thousands of people in our community, and we've not seen any serious side effects from this. We've seen relatively few minor side effects. It's the same thing as when you get a flu shot. You might feel achy or just not quite right for a day or two, and then you're over it. There's nothing ominous about this vaccination. I've made it my personal goal, and I know a lot of physicians have, to try to be transparent, get the truth out there, and let the people know from a physician's standpoint what we think of this pandemic, what we think is the best way to help you prevent yourself from getting the disease, from spreading the disease, so on and so forth. What have we seen from a standpoint of the health in our community? When we rolled out the first series of vaccines, we were in a crisis here. We had the most patients we've ever seen in the hospital with COVID. We had about a 30% positivity rate. In other words, 30% of the people that were being tested were found to have COVID. Once the vaccination was given in this area, and roughly 40 to 50% of our community got the vaccination. Roughly almost 50% of our employees took the vaccination voluntarily. We saw our numbers go from, I think at one point we had a high of 80 patients in the hospital with COVID. We saw our numbers go down within a couple of months, 3-4 months, to maybe having one patient in the hospital with COVID, 2, sometimes none. And until the Delta variant came along, we had almost no COVID. Now we're back up to the same rate and even higher than we were, because we still have so many unvaccinated patients or persons in our community. "87% of the people we see in the hospital right now with COVID are unvaccinated. And they're very sick. They're sicker than the first iteration of COVID. A lot more people are going into the ICU. A lot more people are requiring ventilator support. The mortality rate is higher. So I think with each successive variant of COVID, we're going to see potentially a worse variant. I can tell you right now, if you're hospitalized in our area, and this statistics holds up I think pretty much nationwide, if you're sick enough with COVID to be hospitalized, there's a 1 in 10 chance you won't make it. You will die. If you go to the intensive care because your COVID is that severe, there's a much higher risk that you won't survive that illness. Of the people that have had breakthrough infections that have been vaccinated and got COVID, we're finding them to be much less likely to be admitted to the hospital, and their disease is usually a lot more mild. My assumption is this is not going to go away. Hopefully it'll become much less of a problem than it is now. Hopefully as the vaccinations develop, we can have an annual vaccine just like we do an annual flu vaccine, where they can predict what the variants are going to be in the future, and they can develop the vaccine towards that. That's what they do with the flu now. Most of the time they get it correct, occasionally they don't, but it'll still give some protections. I think the biggest frustration is how politically polarized this entire pandemic has become almost from the onset. And had it not been for that, at least in my opinion, we wouldn't be nearly in the shape that we are today. I think everybody, this is still a free country, and I think everybody still can have their own opinion about something. But the problem is the amount of misinformation that's gained traction, and I think a lot of that's due to the distrust in the political system. I do think that there's some people who are absolutely entrenched in this idea that the government caused this, that there's this whole big power play some way just to try to keep them down and take away their voice. I don't feel that way, and I can tell you that the majority of physicians nationwide, and especially in our area, have gotten the vaccine. It's probably over 90%. It's probably closer to 100%. So physicians believe in the vaccine. They believe it works. We've seen it work. We've seen what happened in our own area once the vaccines became available. And up until the time of the variant, we were seeing dramatic success with the vaccination. And I think we still will if we continue to vaccinate and they continue to develop the vaccines.